Now, kick it against the sighting of an isolation center is fast becoming a norm in Ghana. Every week, a news item pops up with residents and communities rejecting the sighting of isolation centers in their communities. Now, just last week, residents in Obuasi joined the growing list of community members protesting against the move. The actions led to the security forces being brought in to ensure law, order and compliance. Incidentally, Obuasi has the highest number of confirmed COVID-19 cases in the Ashanti region. The region has 726 confirmed cases as of Thursday, May 14, 2020. Now, 20 out of the 43 districts in that region have recorded cases of COVID-19, with Obuasi leading with 294. But Obuasi is not the only place where the sighting of an isolation center has been rejected by residents. We have seen similar protests in the Asin South district as well as in Efutu in the central region. Now, in Greater Accra also, residents of Community 16, Bachona, Sprintex and Pram have also kicked against the sighting of isolation centers in their areas. Now, for those rejecting the isolation centers in their communities, I have a few questions for you. Tell us, where would you want to be taken if you contract the virus? Should we leave you to stay at home and go to work to infect your family, your friends and work colleagues? And where do you want to be treated if you contract this disease? So for those of us who have not contracted the disease, let's remember we're not better than those who have. So rejecting them in their communities is wrong. But there are several reasons why we appear to be seeing the rejection of isolation centers by residents. In most cases, the residents are not well informed on the issue, mainly because education on the matter has not been effective. Education on this should not end with a press conference. The various informal and other formal channels of education must be engaged and a system of assessing the effectiveness of same put in place to inform what changes will be needed to achieve optimum results. Now also, the choice of the sites for isolation centers in communities must not solely be decided from Accra or regional capitals. The communities must be involved in the decision to have these centers there. Further, the fear of contracting the disease by residents is also a factor. And again, we can attribute this to low sensitization on the subject. Now, even though the actions of such persons must be condemned, we must ask ourselves as a country whether we have done enough. We've done the needful also in ensuring that we have educated our citizens enough in understanding this virus and its negative impact on our lives. Now, the implication of not dealing with this matter of rejecting isolation centers by communities is enormous because we are all at risk if we cannot get a place to isolate people who have contracted the disease. Now, the isolation centers are needed to not only treat people, but also to hold them to stop further spread. When people are at an isolation center, they have access to good health care while their progress is monitored by healthcare professionals. So an isolation center in your community will not only protect you, but it will also shield persons living in the community from further spread and also infections. So what do we do? Now, COVID-19 is new to all of us, which reinforces the suggestions that stakeholders in communities where we want to have isolation centers, including chiefs, opinion leaders, residents, must be part of discussions leading to the siting of the centers in their communities. So we need the Ministry of Information, assemblies, the NCC, among others, to seriously engage communities on the need to have these centers there. Now, after this is done and residents still refuse to comply, then authorities cannot be faulted if they employ security personnel to ensure compliance. This has been Vivian's View. My name is Vivian Kai Lokko. Thank you for watching What the Papers Are Saying. Goodbye.